Hi guys, welcome back to a special episode of What's Up Doc. We decided with the pandemic going on with coronavirus, it was important for us to do an episode on basics of this disease so that we have a source of information for people that they can understand and know what is going on for right now. So without further ado, I am working with my favorite coworker and my famous coworker, Josh Lerner, who has been on CNN, Good Morning America, and is going to be published in Scientific American.
Thank you, Alex. Dr. Alex Weil was the chief of emergency medicine when I was hired. She hired me, so we've had the pleasure of working together for a while, which is always fun. We always have fun in the department.
We do, yeah. Without going into too much detail, corona is a virus. You know it also by the name of COVID-19. It is a virus that they believe started in China. And they initially thought it came from this food market. But the more research that's going on, the more they've identified that it's actually, they don't know. And we knew that it did come from that region, but whether or not it got brought in, etc. The very first patient, like we hear patient 0, actually wasn't at the food market. So who knows? The reason it's called corona is because that virus, when you look at it under the microscope, has these little spikes, and they say corona crown.
That's interesting.
Not named after the beer.
Not the beer. The beer company wants you to know that for sure. So what are the symptoms of COVID, potato, I guess, COVID. What are the symptoms of COVID-19? I think initially we had thought that they were all respiratory symptoms. Yeah. So we were talking fever, cough, shortness of breath, chest pain. But as we have learned more about the disease, we're seeing that people can have very mild symptoms, just, runny nose, feeling a little under the weather.
Just tired even.
Just might call it like a cold one day.
Right.
Some GI symptoms, vomiting, loss of appetite, just not feeling your best, has been sort of shown to potentially be COVID-19.
It's kind of like typical virus, right?
Exactly. And so, we say 80%, we think about 80% of people who get COVID will recover without any intervention. It's like they had a bad cold or maybe a bad case of the flu. But obviously there are populations that are much higher risk
that we worry about.
That we'd be much more worried about having much more severe symptoms, the stuff that you're hearing on the news. So a lot of those populations are people who have sort of what we call comorbid illnesses, things like diabetes, high blood pressure, history of cancer or malignancy. What else do we have?
So I think a lot of people associate those things with older populations, but that's not true. I mean, when you think about cancer, we have young people who are getting chemotherapy and they're at high risk. So I think that, the sicker you tend to be, the more at risk you are. And that tends to seem like it's an older person disease, but it's certainly not limited to older people. So what about treatment? Well, it's a virus. The problem with viruses is that we really don't have a lot of great treatment for viruses. You want to prevent viruses, and that can be from developing a vaccine, which we don't have right now, or it's once you have the disease, it's all supportive measures, right? So supportive measures when you have severe respiratory issues or things like being on a ventilator, but the big thing is prevention.
Yep. Yeah. Absolutely. An ounce of prevention beats a pound of cure, I believe is the expression.
Exactly. So what are the things that we can do? One, wash our hands, right? So it's prolonged hand washing. It is not the dip and go. It is the 20 seconds of soap and water, and it seems like forever when you're doing it, really. That's one of the things. The next one is coughing into one's elbow, hopefully collecting a lot more droplets than in your hands. And the other part, too, is if you cough in your hands, what do you do next? You touch a doorknob or something like that. We also talk about 6 feet between people. This is because as a disease process that's spread by droplet, you're trying to make it such a distance that those droplets, they're falling within the 2 feet of your personal space. And then the last one is stay at home. Stay at home. Don't go out.
Absolutely. One more thing would be something Alex and I are both guilty of probably during this video is touching our faces.
Oh, that's right.
That's
the other one, the
Alex
big
had
one.
mentioned, you touch the doorknob and then you go and you touch your face. And so that's trying to be cognizant of that so that that's how you would potentially transmit it to yourself.
Yeah, that's a good one.
And we're both guilty of that probably during this video. So
Probably. All right. So let's talk a little bit about why we even care about this.
So one of the main things is what's all the fuss? Why is this in the news? And I think it's because this disease is so contagious.
Yeah.
We have seen people who have COVID who they have no idea who they got it from. They don't know. They didn't even know they were around someone else who was sick.
Right.
And so it spreads very quickly. It's spreading rapidly, and then it affecting a large percentage of the population.
And whenever you have a disease process that has that kind of quick to pass on, it's called, you're making a sharp curve, an upward curve that is very steep. So we have this phrase now that everyone's pretty, using very often called flattening the curve.
Flattening the curve is basically trying to spread out the sort of time with which the population gets infected. And the reason is because obviously if everyone gets infected at the same time, we're using all of the resources at one time, and it gets used up very quickly. So, for example, you hear about patients with COVID needing to go on ventilators. People who go on ventilators are on ventilators for a long time, days if not weeks. So if everyone goes onto a ventilator at the same time, we just don't have enough ventilators. The same goes for hospital beds, for any type of resource. And so by flattening the curve, we're trying to at least spread out the time with which people are getting infected so that people can come off ventilators so that other people can then use those ventilators.
That's right. And we're also, if you can flatten that curve, it means that the number of people infected at any given time is less, which means that, for example, healthcare providers, you're not having every single healthcare provider come down with this illness within a week. Mm-hmm. And we'll knock out a whole entire ED if that's the thing. So I think, we've talked a little bit about what this virus is, what it can do, and that the best approach at this point is prevention. Any last words?
Stay safe out there. Alex, everyone, stay safe.
Stay safe and stay at home if you can. Thank you guys so much for tuning in, and let's give us 2 thumbs up if you enjoyed watching this video and thought it was helpful, and please subscribe to our channel, What's Up Doc. Thank you. Bye.
Bye.